This presentation will go through how to perform a manual blood pressure assessment. First of all, let's talk quickly about the reasons for doing a manual blood pressure. Most places have automatic patient obs machines now, right? Well, in hospitals that might be true, but if you are practicing in the community or in a clinic, you might not have access to an automatic machine and may only have a manual sphygmomanometer. Also, machines are not always accurate. If a machine gives a reading that concerns you, it should always be checked against a manual reading to ensure accuracy. In terms of patient preparation, it will be pretty much the same as for the patient obs with an automatic machine. Explain to the patient why you are checking their blood pressure. For example, it's part of the standardised assessment prior to participating in an exercise programme, or it could be because the reading the machine gave you was not what was expected, so you're just double checking. Advise them it should feel just the same as an automatic blood pressure cuff. Infection control is the same. All equipment should be wiped down before and after use, preferably in front of the patient so they can be assured that correct infection control practice has been followed. Remember your contraindications to putting a blood pressure cuff on a particular arm: upper limb fractures or injury, recent surgery, active disease or pain, arterial venous shunt, breast, axillary or shoulder surgery, casts or bulky bandages, lymphedema or known vascular disease in that arm. Okay, let's have a look at this in action now. Now I'm going to go over how to take a manual blood pressure. We really only use manual blood pressures where we don't have access to an automatic blood pressure machine, but also in situations where the automatic machine is giving us an alarming reading and we want to corroborate that information. So we've got this patient already with the blood pressure cuff on, connected to the manual sphygmomanometer. It's on the wall there. You'll need your stethoscope for this, and it's a two-stage process. So the first stage, I'm going to get an estimated systolic blood pressure. So I'm going to do that by palpating this patient's brachial artery. So the brachial artery is palpated on the inside of the elbow, just medial to your biceps tendon. So if you're struggling to find the pulse, ask the patient to bend their elbow. Okay, don't let me move you. Find their biceps tendon. Okay, and relax. And just drop just inside that. Okay, and you'll find your brachial artery pulse just sitting just there. You want to make sure that your valve is fully closed, so turned all the way to the right, but not so tight that it's not going to be able to come off easily. And that'll be important later. So it should be closed. I'm still feeling for that brachial pulse. And what I'm going to do is gradually inflate the cuff. I'm watching the numbers on the sphygmomanometer on the wall behind me. And what I'm doing is monitoring for when that pulse disappears, which is somewhere around about the 105 mark. And that gives me an estimated systolic reading. Okay, so the second stage of this process, I'm going to be listening with my stethoscope. So stethoscope in, remember earbuds pointing forwards. And I'm going to make sure that the small bell of my stethoscope is turned on. I'm twisting. So if I tap here, I'm going to be able to hear. You're going to place that over the brachial artery. And now what I'm going to do again is inflate the cuff to about 30 above what I estimated the systolic. Slowly release. Okay. What I was listening for was tapping noises. So the first tap I heard indicated a systolic blood pressure of around about 106, and when that tapping noise disappeared, that's the diastolic blood pressure of around about 70. And that really corroborates what we found when we did it with the automatic blood pressure machine. So that's how to perform a manual blood pressure. Just a couple of safety considerations with this technique. Ensure that you give the patient adequate time between the palpation and auscultation components of this technique to allow blood flow to be restored to the arm and hand, and be careful to never leave the cuff inflated. Watch for colour changes in the hand that could indicate reduction in circulation. In terms of interpretation, this graphic will help you to understand what you are hearing. This image represents a blood pressure of 120/80. When the pressure in the cuff exceeds systolic blood pressure, the artery will be fully compressed and no blood will be flowing, so no sounds will be heard as long as the cuff is inflated above 120 millimeters of mercury. As the pressure in the cuff falls below systolic blood pressure but above diastolic blood pressure, the blood will flow through the artery on systole but not on diastole. So you will hear the pulsatile nature of this blood flow as tapping sounds, called Korotkoff sounds. As the pressure in the cuff falls below diastolic blood pressure, normal flow is resumed and again no sounds will be heard.